Hi guys, my name is Angel Harless and I am a DNP F&P. I work as a hospitalist for a level 3 trauma center, which used to be a level 1. I think sometimes we still operate as a level 1. I was just wanting to get on here and kind of lay it all out there on the table for my F&P folks that are thinking about going into hospital medicine as a hospitalist. It is not easy. Essentially, everything that you learn in school is geared toward primary care in the outpatient setting. So unless you're acute care, you essentially have to relearn everything, which is very difficult. Everything you learned about diabetes, for example, you might as well just throw that out the window. Typically, we put our diabetics on a sliding scale just because of the reactions with common medications and CT contrast dye. So a lot of things that helped me was self-study. There are a few really good books too that I would recommend, and I'm going to show you what they look like. The pocket notebook is really good for either internal medicine, or if you want to work in the ED, they have an ED version of this. This is really, really good. It's very short. It is small, so a colleague of mine said she wanted to use a magnifying glass to read it. But I really like this book. There's also another one that I would recommend, but I don't have it with me, so I will get all my resources together and I will post them in a video just to kind of show you guys. But I kind of just wanted to lay that out there. Like, when you come into the hospital, you're essentially going to be relearning everything that you've already learned for however long you've been in school. So you are going to be starting fresh and anew, and it's going to be a lot different. Now, the hospitalist setup where I'm at, we do most of the admissions, and we also do the transfer calls. We do all of the consults to the specialist. So if you are somebody that's a little nervous calling a specialist as a nurse, then so definitely think about that, getting yourself used to throwing yourself out there, presenting the information to the specialist. Now, some places have NPs round, which is really cool. And I wish that were me. I feel like you can follow the patient a little bit better. Essentially, when you're doing the admission, you're doing all of the grunt work, but you're not getting to see, did they get better from what I implemented, things like that, unless you take call, in which we do from 5 to 7. So I would recommend finding a system where NPs can round personally. But if you like doing admissions, then, that's typically what the hospitalist role is for NPs. There are some difference in systems, but this system is mostly admissions. And then they do have, at some of the other hospitals, some rounder positions. So I would just kind of think about that. Like, are you, when you're going and you're just trying to get experience, I understand you'll kind of take whatever job, and I understand that. But I would definitely think twice before I took a hospitalist medicine job, just because you have to relearn everything. Now, if you're a learner like me and you hey, I don't care, like, I'm happy to get in there and learn, then, you'll be fine. But if you're somebody like, oh, I'm really done with all the major learning and studying, and I just want to go for what I was, originally taught for, definitely go outpatient primary care. Do not start in the hospital. And I wish somebody would have set me down and told me all these things before I started. A little background about me. Like I said, I was a DNP F&P. I did a residency program right out of college in primary care. and a subspecialty in addiction medicine and psych. So I kind of had like a little bit of that. And so I felt like pretty good in primary care. And then I took this job and it was like, oh, okay, well, I know nothing. You know, I had very many nights feeling like, oh gosh, like I'm an idiot. I can't, you're not an idiot. You're not stupid. It's just completely different. Okay. So don't get discouraged. Just, you know, keep trucking essentially and just study your tail off. Now, if you're acute care, you're still going to have to study, still going to have to get your feet wet, but it's going to be a little bit easier for you to make that jump into hospital medicine. But I've really enjoyed my time here, but I think just because of the 7 on, 7 off schedule, so we work 7 on, 7 12s on, and then we're off for 7. I just had a baby back in January. That's pretty difficult for me and my family to work out babysitting schedules. So I'm actually going to be going to functional medicine soon. So I hope you'll follow me on my journey there as well. And I'll kind of be, you know, it's like a root cause medicine. I'm really excited. I think that it'll be a really good change for me. But I hope you guys see me there. And then if you have any questions, please do comment below and I'll do my best to answer all your questions. And I will post a video of all the references that I use and that I think, you know, you guys may really enjoy and use every day.